Let's address some flexibility and stretching issues. There's many different approaches to flexibility. We need to understand some basic foundational concepts. And when and how do we use flexibility? It's commonly overused. In fact, it's commonly overlooked. Typically, what we've found is that people do flexibility at the end of a workout. Most of our training and our education has been cardiovascular training, strength, and then flexibility. But in fact, many of the injuries that we see are due to lack of flexibility in one joint or a series of joints, and there can be ramifications throughout the body of what flexibility can impact. So let's address some of the concepts. First, range of motion. We have to understand that flexibility is essentially a range of motion around a joint or a series of joints. Secondly, flexibility is limited in the fact that if a joint is limited in motion, or flexibility can be limited in how the tendons move, how the connective tissue moves. So there's a bunch of issues that address it. We're looking at skeletal if the joint has some issues or lack of motion or osseous changes or degenerative changes. It could be just the bony structure itself, just the way that the joint is made and the amount of motion that it has, but also connective tissue, tendons, ligaments, muscle tissue, the fascia. If that's tight, is going to have an impact upon the range of motion of a joint. Now, if you have limitation in one joint, chances are it's going to affect other joints, which is going to have an impact on other joints and so on. So flexibility can also have a significant impact upon your posture. Limited flexibility, if it changes posture, can increase the risk of injury. In fact, about 80% of injuries that I have seen typically are due to lack of flexibility around a joint or maybe even more than one joint. So flexibility is extremely critical for optimal function. Flexibility is going to vary as we age or amongst gender. As we age and or become more sedentary, we lose range of motion, which is going to increase the risk of injuries. Typically speaking, females are more flexible than males. Now, we have to keep in mind that that's just a generalization when we think of all ages and we think of all backgrounds and all exercise and training regimens. So think of muscle mass, think of mobility, think of joints and how they move, think of how one joint is affecting another, and that essentially is going to give you a profile of what flexibility is for your client. Many clients will present with individual issues varying from good range of motion to limited range of motion. Sound range of motion testing and flexibility measures will give us an indication of what their limitations and any compensations that may develop. So if you really think about it, we should have a system, a battery of assessments, so to speak, of just how we move. Now, the issue is going to then be, do we test or look at movement in isolation, which is doable, but we also have to look at it through movement, through integrated movements, because you could have a limited range of motion in a joint when people move, but you get them on the table and you're going to see that in isolation that joint may move just fine. So that's going to tell us there's another place around the body that's impacting how that particular isolated joint is being affected. So we need to look at people individually, and we should actually prescribe their own flexibility programs. Don't look at the individual compared to others of their age group or their gender. I prefer to think of how we compare themselves to themselves, think of you to you, and measure their improvement from one session to the next, but not against others, because nobody has the same background, nobody has the same health history, nobody has possibly the same exercise regimen or history of exercise. If they've been sedentary, there could be a lot of issues that contribute to it. So flexibility can be easily integrated into training programs. Flexibility, if done properly, doesn't necessarily have to be a separate session or a separate time dedicated in that training session. It really can be used as an integrated warm-up. It can be used in many ways to make it very time efficient for you, the trainer, but also make it very time efficient for your client. Now, when we look at the flexibility continuum, we can look at hypomobility, or very little movement. That can be due to a fused joint where there's been so much degeneration in the joint that the bone starts to fuse with their adjacent bones that form the joint. It could be scar tissue around the joint. It could be adhesions from a previous injury that is creating limited motion. On the other side of the coin, it could be a hypermobile joint where there's too much movement. That necessarily isn't good either because we don't have the integrity of the joint to be able to hold its position. If you recall, all muscles, all joints work in 3 planes of motion, and we have to be aware of how does that joint move, and if there's too much motion, is it because it's the joint that is having a problem? What plane of motion is the joint having the problem? But one thing we also have to think about, particularly when we start talking about an integrated approach to flexibility, is that joint too mobile, or is another joint above or below less mobile, creating too much movement in the one joint? So flexibility is not really an isolated incident, it's an integrated approach. Then we've got the optimal zone. Each joint is going to have its own optimal range of motion, but keep in mind we want to keep it individualistic to the client that you're working with. So benefits of a good flexibility program. Increased range of motion can significantly reduce the risk of injury. Flexibility by itself will not prevent injury, but it can help reduce the risk of injury. So we want to make sure that we have good range of motion through the joint, through the muscle tissue, through the connective tissue, but obviously within an optimal range and nothing that's too much range of motion that can create an instability or create increased risk of injury. Likewise, having good range of motion will enhance your biomechanical efficiency. It will allow the body parts to move with each other and make motion very effective. Likewise, it will make the motion very efficient. If we have to jump, as an example, and you don't have enough motion through the knee, you may have to force range of motion or increase range of motion elsewhere and create other issues and make that jumping action inefficient. But if the knee, hypothetically in this case, has good range of motion, it will allow good movement. It will allow the muscles above and below to load properly, the joints up above and below to have good range of motion and to load properly, and then we can get this explosive movement. But again, the knee in this example may be limited in motion. We could test it and see, but also have to check what's going on at the ankle, at the hip, and also even the back. Good flexibility will improve coordination between muscles and help improve posture. It increases the fluidity of motion, and it helps decrease the risk of joint pain, and it also helps promote motion, which can help slow down the aging process. And of course, if we move properly, if we have good range of motion, it makes our body just feel a lot better. The factors that can affect flexibility are age, exercise history, meaning if we've been sedentary, the joint is going to have limited range of motion. You will not see a joint that has as much fluidity, that has much lubrication from the synovial fluids in a joint that has been limited in movement or that has been inactive. So if I have somebody who has a greater range of motion, or I should say a greater exercise history, and they're consistent, typically we're going to see that their flexibility becomes greater. Heat is an issue that will help allow greater viscosity through the muscle tissue and around the joint. Think of starting your car. And when you start your car on a cold day, it takes a little bit of time for the engine parts to get moving because it doesn't have the fluidity of the oil lubricating the joints. But on a warm day, it's much easier to start the car, and it's much easier to just drive off. Joints are no different. Joints move in a warmer environment because the fluidity of motion, because the molecular flow and activity that goes on in warmer environments versus colder environments. As we age and or become more sedentary, we lose range of motion. Aging does not have to be a limiting factor in flexibility. If we've been active all our lives, if we incorporate flexibility in all 3 planes of motion, if we have an integrated approach to flexibility, you will see that the aging process of that joint typically is slower. Likewise, females, generally speaking, have greater range of motion than males. Part of it is because of the increased muscle mass that males have. Part of it is just the bony structure itself. But typically, we find that women categorically have more flexibility than men. The joint health is critical. If you have somebody who has arthritis, that has an inflammatory condition that's affecting the synovial fluid, that's affecting the cartilage and the labrum, and affecting the overall capsule of the joint, that is going to make motion around the joint limited. So the issue with those people who have degenerative joints, motion is really their gift to help improve flexibility. Your specificity of training is important. We want to be able to train our clients through movements that are going to enhance and reinforce what their goals are and their activities of daily living. If you have grandma, as an example, who just wants to move better and to work around the house and do activities that are enjoyable to her and her hobbies, we want to be able to allow our flexibility programs to almost imitate and go through the planes of motion, all three planes of motion that are going to be enhancing her quality of life. We also have to look at what activity levels does our client have? What are their choices? What are they looking for to improve their activities of daily living and to meet their goals? And that's the key. Don't make this just a generic program that one size fits all, so to speak, but we want to be able to address the goals of our clients. Tissue temperature goes back to heat. When we're warm, our tissue temperature is greater. The viscosity and flow of the fluids in our tissues become greater. And we're able to flow through a movement much more readily than in cool, colder environments. Pain. Pain is not just something that bothers us. Pain is a physiologic response to tell us something is not right. Let it be if it's locally in the joint, locally around the tissues, or somewhere globally around the body. Pain is going to be a limiter in movement. Pain is also going to send us a nerve signal to more or less shut down the muscle activity so we don't further injure ourselves if in fact that movement is injurious and creating that pain cycle. Injury also is going to create a lot of cellular changes that will interfere with the flow of our joints, that will interfere with the articulation of one bone to another. So injury is going to limit range of motion, but at the same time, movement, proper movement, movement in a plane of motion where the client is successful and not having as much pain, movement is also going to be the nourishing gift that can help improve the injury, to help heal the injury, and get the joint to operate and move properly again. And then the soft tissue structures. The soft tissue structures are important in not only creating the stability of the joint, but also if there is a healthy tissue around it that will enhance healthy movement of the joint. However, we know that the soft tissue is also controlling the movement, and the soft tissue, if it's injured, can limit not only the range of motion through the soft tissue, but that, in effect, is going to limit the range of motion in the joint. We've heard about static flexibility, we've heard about dynamic flexibility, we've heard about ballistic flexibility, and let's kind of explore those for just a moment. Static flexibility is the gradual stretching of a muscle to a point of mild tension. We don't necessarily want to go too far and hold it too long, but we want to be able to hold that position and really not bounce too much. So we've seen it a lot with the hamstring stretch. You put somebody in a seated position, or you may put them in a supine position and get into hip flexion where it's stretching the hamstring. Go to the mild tension, hold it for about 15 to 60 seconds, return to your start point, go ahead and do another 2 or 3 repetitions, but each time you go, just slowly, ever so slowly, increase the range of motion, and over time you're going to increase the range of motion of the joint and the length of the tissue. Static flexibility is it's a safe and effective method, but not necessarily the most efficient method. It's excellent for beginners and people who want to train on their own. Start for about 15 to 30 seconds for maintenance, and then go for about 30 to 60 seconds to improve range of motion. 3 to 5 times a week is what I would suggest. Now your ballistic flexibility I think has a generic term to it. Ballistic flexibility we generically think of as bouncing, but ballistic flexibility really is movement, and I think we can put that under a category of dynamic flexibility. When we look at dynamic range of motion, we can look at it as stretching, but not just bouncing in that position. Yes, bouncing is part of that. The issue about bouncing, particularly if it's a cool muscle or somebody who's been limited in motion, we increase the risk of injury, or we increase the risk of setting off our myotatic reflex, which can create shortening of the muscle in the long run. So we have to slowly increase the range of motion, because as we increase the range of motion, particularly through movement, the tissues lengthen. We're doing this through 3 planes of motion, but what we're also doing is lengthening the proprioceptors, which kind of give us an idea of where the muscle is in its muscle tension length, but also where the joint is, and one bone is in relation to another bone, so we have an idea of where the joint is in space and in relation to the rest of the body. Dynamic flexibility can help reset those proprioceptors. Dynamic flexibility can also increase range of motion, but through an activity. So it doesn't necessarily have to be the ballistic bouncing type, but just going through a range of motion and back, reaching and coming back. And if we start slowly and slowly increase that range, we're going to start seeing, yes, it is ballistic, but we start to see our muscles lengthen. We see them lengthen in 3 planes of motion. We reset proprioceptors. All of a sudden, we've got an increased mobility. Now the question is, we have to make sure that we have a stabilizing activity to help control that increased range of motion, and that's where I think we go wrong as an industry. We'll give a stretch, but not necessarily an accompanying exercise to control that range of motion. If we give somebody a stretch, and often through a ballistic stretch, where they've got increased range, we don't have an activity to get the muscles stimulated to control it, we've actually set them up for an increased risk of injury. This method, for beginners especially, can be extreme on muscle and cause some muscle damage. So we want to start slowly with our sedentary population. We want to start slowly with our beginners. Keep in mind, don't think that through that ballistic activity that we have to go through the full end range. Unfortunately, trainers think this way because many of them that I've talked to just assume that people are fit like most of the trainers in our industry. So the trainer goes through a full range of motion demonstrating it, and our clients want to look good to our trainers, so they try and do the same thing when they're really not fit to do so yet. So we can position them in a certain way or get them to do that ballistic movement, but just make it slow, oscillating movements as things loosen up, as tissues loosen up, as they become more mobile through it, then slowly increase the range of motion, and before you know it, we're going to have an increased ballistic or dynamic range of motion. Which leads us to the last point, that historically, ballistic flexibility has been used by highly trained people, and it still is. But the fact remains is that it has been traditionally used by dancers, by gymnasts, and power athletes. But again, they are fit enough to go through a wider range of motion than our sedentary beginning population. There is not necessarily any reason not to take them through, our beginning clients, not to take them through a ballistic movement, but again, make it abbreviated, make it short, and make it more rhythmical and smooth, controlled motions before we increase the range of motion and make them more dynamic. PNF, proprioceptive neuromuscular facilitation, commonly called contract and relax stretching. It's an extremely effective tool in our toolbox of stretching. And that's what I believe trainers need to do, is become exercise brokers to know when to use certain exercises, certain stretching modalities, but also why they're using it. And remember, we have to understand the whys. The PNF stretching, it produces best results, typically done with a partner. The technique is stretched to a mild point of discomfort. I don't necessarily want to use the term discomfort, but some mild tension, and perform a static stretch. Often we do so as the partner resists us as we go back to our starting point. In other words, if you're going to do a hamstring stretch, have your client lie supine, and as the trainer, you're going to take the leg and go into hip flexion. So you're going to stretch the hamstring, go to the point where it's a mild tension on the hamstring, and give just a few percent of resistance to, as the client goes back into hip extension, brings their leg back to the ground, what we're doing is resisting that. What that is doing is a few things. One, the muscle is stretched. Two, we're keeping it in the stretched position, and as they return to the starting point, we're still have the muscle eccentrically loaded, so it's stretched, but it's also contracting. The 2 points where it's connected are keeping their distance, but the tissue is lengthening, and it also resets the proprioceptor, so we do increase range of motion. So I do use this. I highly suggest that we use it. You can repeat the process 3 to 4 times on a particular muscle group, but remember, we've got to be cognizant of the connective tissue, how it's feeling to the client, and make sure that joint is going through the range of motion, because if we don't get them through a good range of motion and they contract too hard or we give too much resistance, we're increasing the risk of some tissue damage. So we're not trying to beat up the client, we're just trying to give them mild resistance as they're returning to their starting point. Use PNF after the body's warm. Typically, and I'm just using this as an example, but typically if I am going to use it, I often use it after the workout when the body is already warmer. Isometric contraction should never be explosive. In other words, when you're resisting them, they should not be doing a powerful contraction against maximal or near maximal resistance. Isometric contraction should involve a gradual increase in the effort. Have the client start slowly and let them get the feel for it. Let them actually dictate how hard they're going to go, which will have an impact on how much resistance you may give them. But have them go into a gradual increase in effort after a couple of seconds and then sustain it for 5 to 10 more seconds. And the partner should only resist in the isometric phase, give a slightly gentle resistance in the static phase. Once the partner, or in this case the trainer, you see that there's more fluidity, then once you give the second or third repetition, that's when you can slowly increase the range of motion to the point where they just feel the mild tension. Relax into the stretch and breathe slowly and evenly. There's an issue right there because many clients, when they stretch, hold their breath. When they hold their breath, we're not getting good circulation of oxygen to the tissues. We have buildup in waste materials, especially carbon dioxide, that creates tension in the muscle. Make sure that they breathe deeply and exhale deeply and make it rhythmical. Take the stretch into mild tension. Don't go to beyond where they have too much discomfort. Tension should subside as the stretch is held. The reason being, the proprioceptors in the fascia are more or less lengthening to match the length of the tissue. So it's also resetting the proprioceptors. Stretch when there's blood flow and the body's warm. You'll get much better results. You're going to see much safer results, and at the same time it's going to be smoother and it's going to be more comfortable for the client. Different types of flexibility can be incorporated into one session. We can do a PNF. In fact, if I can give a quick example, when I have somebody and I see that their movements are a bit limited after we've gone through a active warm-up. If I see that there's just not that fluidity and synchronicity of movement, I'll stop, put them on the table, put them on the floor, whatever may be the case, and I'll take them through a PNF stretch. Get the movement, get a little bit of mobilization through the musculature, through the joint, get back up. We immediately do an integrated approach or a dynamic flexibility again so I can get the muscles to start controlling that range, and I've had very good success with it. Likewise, never encourage the clients to overstretch muscles. You don't want to overstretch the tendons or the ligaments beyond a certain active range of control, especially ligamentous tissue. If it stretches and it goes too far and it becomes stretched and injured, it's not going to go back, and now we start to have a joint integrity issue. Start with about 3 to 5 times a week to improve, and even 1 to 2 times for maintenance. I highly suggest my clients maintain the 3 to 5 times a week in flexibility. If I even have somebody who has been limited range of motion, typically a beginner, typically somebody who's been sedentary, I may have them stretch twice a day. If they understand how to do it, it doesn't take a lot of time. But it's important that they increase their range of motion. The intensity should have some slight discomfort, some slight tension, and hold it for about 15 to 30 seconds, 30 to 60 seconds if we really want to improve the range of motion. There's many studies out there that talks about long-term stretching, meaning long periods of time of 5 to 10 minutes of holding a muscle. I don't encourage that because studies have shown that the muscle actually is going to get weakened and turned off. So just the brief ranges of motion, just a brief time, more repetitions I found to be successful. But we can blend the two of dynamic as well as static stretching.